moment, I'm enabling all of you to record today's presentation. And in front of you have Dr. Felix Cabrera, representing the Physician Advisory Group. There's still a few more reporters just joining us right now. Just give us a moment. Record. Good day, everyone. Thanks for joining us. This is Dr. Felix Cabrera, representing the Physician Advisory Group as well as the State Surgeon Cell, and he will be making a presentation for you.
Thanks so much, Crystal. Half a day, everyone. I just wanted to share, I had some issues about trajectories that we had, and so this is nothing similar to what we had shown in the past during the first wave, but we have been tracking one particular trajectory, and so I like to share that. It's just one slide. And so what you'll see here is basically Guam's COVID-19 hospitalization trajectory scenarios, and it's as of August 28. So just to get you oriented here, so on the left axis is the number of patients admitted to all the hospitals on the island, is how we're counting this now. What you see, black line is the actual numbers that we've had. And as of this morning, there were 41 admitted patients, 33 to GMH, and 2 still at GRMC, and 6 at U.S. Naval Hospital Guam. And 5 of them of the 41 are critical care patients. So what we had here is that we, again, in the black line being the actuals, we started doing these trajectories last week and started looking at where things might be. And so you see this in the dotted line is where we thought things might be. And then the rest of this dotted line is the plausible worst case scenario is what we've been, what we defined it as. And it looks basically at a 14-day trajectory based on recent, the 14-day census growth rate. So that's what you're seeing in the red. The green was just using
Doc, sorry to interrupt you, Doc. Can you make that image larger? It's not filling our screen up.
Oh, I'm sorry. I think it's up and now if I just do it this way.
Much better, thank you.
Okay, sorry about that. So again, this is a looking at our trajectory overall. The red again being the plausible worst case scenario, and that's the method for that is using a 14-day trajectory based on recent 14-day census growth rate. The green is a more conservative method, and that's using a trajectory based on recent 14-day CAR score summary as it correlates a forecasting tool. It's a long way of saying that that's basically just the conservative trajectory that we have here. So the concerning part here is that even from earlier this week, we what we thought was a plausible worst case scenario being these small red dots, we've actually been trending above that as of late. And so that's, of course, more of a concern for us as we move forward. As mentioned in yesterday's press conference, we are looking and trying to predict when there may be a peak in hospitalizations and the timing for that. If it's similar to the wave back in March and April, then it could occur about 10 to 15 days after the island's mobility 7-day average drops below 80%. So in other words, when people start adhering more to the PCOR1 orders and including the stay-at-home orders, then that's when we will see, in all likelihood, a peak of the hospitalization and hopefully a rapid fall from there. So this, on the x-axis, you see different shadings of gray. The first part where the actual dates are grayed out is just 14 days after the initiation of PCOR1. What you see here is actually the island mobility did drop below 80% on last Thursday, the 20th of August. And of course, the stay-at-home orders were implemented on Friday, the 21st of August. And so basically, we're targeting hopefully no later than Friday, the 4th of September to be the peak for hospitalizations. And it's hard to say where in the curve it may end up. the rest of the trajectory may start following the green, but right now all signs are saying that it's going to be following the red line. And so, of course, this is a major concern, and contingencies are continuing to be made to take care of the patients without compromising, standard of care as much as possible. So that's all. I just wanted to share this. This was almost included in yesterday's press conference, but was cut for time. I'll take any questions.
Members of the media, you're welcome to unmute yourself and ask your question.
Nick with the Guam Daily Post. Thanks for this presentation. It shows very clearly what we've been expecting from the get-go, the worst case scenario. But is there still an opportunity for us to beat this in the next week?
So the reality is that opportunity to beat in the next week happened last week. And so it's what we're seeing is at least a 2-week delay based on what the behavior of what we're doing today. It reflects about 2 weeks later in terms with the hospitalization. So we have to continue to keep this as as muted as possible in terms of that, and we don't want this to continue to grow. And once it's suppressed, we want to keep it suppressed. Is this the bottom line?
And for the most part, in terms of capacity, I know we spoke to this a bit yesterday. We will be at least prepared and ready enough to handle that increase, that trajectory.
Well, that's the thing, is that right now it's going to be very, very difficult to do that without compromising the standard of care that we've become accustomed to here on Guam. And I wish I could say with a lot of confidence that won't happen. The reality is that we are continuing to do. We've had a phased plan that was placed from even months ago in terms of how we would scale up. Unfortunately, there's, like anything else in plans, a lot of things can derail it. And one of the main things is how ill many of the actual frontline healthcare workers have become, as I'm sure everyone is quite aware of. So that has really hampered our abilities overall. But the requests are in terms of requests through FEMA and through and aid in terms of getting more personnel. In particular, the physical space is not as much of a concern, of course, as staffing is.
Yeah, that's what I was going to get. Thanks for setting up the next question, where I was going to ask you describe the
Doc,
level of shortage
Doc,
of nurses and doctors and how that's affecting the care at the hospital for COVID patients.
I'm sorry, there's
no worries. If you could describe the level of shortage of nurses and doctors, as you just mentioned, and how that's affecting the care at the hospital for COVID patients.
Yeah, so right now, as it is, GMH has not had to stretch their nursing to patient ratio, is my understanding, and so that's good. But I don't have a number for you in terms of quoting the actual shortage overall. But as Lillian had said in the press con yesterday, that in terms of what was requested in the medical assignment, that it was around 40 nurses, 4 hospital intensivist doctors, and about 8 respiratory therapists.
Doc, so
yeah, sorry.
No worries. Sorry, Nick. So, Doc, how would that work though? If the military brings in medical personnel, would they be authorized to work at GRMC and GMH, or would they have to be stationed at a separate military hospital?
No, they would be. Yeah, they would be. They will be awarded a emergency licensing and privileging as well for this situation, and so they will be placed. It won't. In all likelihood, the hospital that gets the first pick really is GMH, of course, because they are the COVID hospital. But logistically, it may make more sense in some scenarios where they actually work at GRMC in order to offload the pressure from GMH. So those decisions will be made more in real time, I think, as it gets closer.
Is there a date certain for when these guys are going to be here?
Was there a date that was set? No, unfortunately. Yeah, unfortunately, we don't have a set date, and it takes about 14 days. The reality is that when they do come, it's a commitment for about 30 days. And regardless of where we are in this curve, even if we start on a downward trend, which we pray we do, that our current staff need. They definitely need respite, and that this staffing will help provide that as well. So the need is very much there. We wish it could come quicker, and but we'll make do with what we have.
Okay, so we don't know yet when they're going to be coming in. We just know that we made that request.
Yeah, we made the request, and we did have a meeting, a Zoom meeting with FEMA just this morning, where they're confirming that they definitely understand the urgency. And when I say with FEMA, I'm referring also to the Region 9 office, and that they definitely understand the urgency here. They are quite concerned for Guam. They're seeing this, that our rate of increased cases is similar to Navajo Nation, and that's been widely known of how dire things have gotten there during their spikes in cases and hospitalizations.
Okay, I'll defer to my colleagues.
Yes, doctor. This is Jerry Partido from PNC News.
Hi, Jerry.
Is this the last wave that we can expect, or can we still see a third wave, or is this a never-ending cycle, or
Well,
what is your
I think it's pretty clear that until we have a vaccine or an effective treatment for COVID-19, that the potential for another wave will always be there. And so, we actually did a very good job for several months where we didn't have anything close to this. But we've always known that this was a potential, and that we've always been dry kindling, so to speak, and that all it took was a major spark, for flames and fires to erupt from there. So we can't say that this will be the last, even if we suppress this, but I hope that people's memories aren't short, and that they understand how much it really means about personal responsibility to protect, not just yourselves, but everyone else on the island.
Yes, and speaking of the vaccine, we got a report from the CNMI that they got word from the White House that they're already in line to get the vaccine that President Trump has been, arranging for. Are we doing the same thing here for Guam?
Yeah, I'm not tracking that in particular right now. Right, in terms of we're still quite a ways from knowing that could have an effective and safe vaccine, and that's suitable for use. And so the clinical trials are still ongoing. I know that other countries have announced their own version, including Russia, but that's something that we don't have the data to back up any support to make such a request to use vaccines that have been put online in that method.
And one last question. How do we actually treat those patients that are admitted for COVID-19? Do we
Yeah, so
follow some of the the treatments that mainland hospitals are doing? Those
absolutely. And the treatment for COVID-19 is constantly evolving, and what we have is an armament in terms of protocols for certain antibiotics or steroids, corticosteroids, which is something that's been known to be helpful. Now, COVID-19, of course, as we know, is primarily a respiratory disease, and so with that, it's all focused in terms of respiratory care, but the breakthrough that we do have is a medicine called remdesivir, and that has been allocated to all the different states and territory, including Guam's. We've had our stockpile, so to speak, and so we still are using that, and we have that, but our supplies are getting low, and so we hope to get more in. And so remdesivir is typically reserved for the more sick patients in particular. So we're referring to the ICU level of care patients.
Okay, thank you, doctor.
Hello.
Hello.
Off a day, sir. Hi.
Hi, Joanne.
So, my question. Hi, sir. So my question is about the GDOE school aids. So will they be having any training to be helping out in the hospital? And will they have like a certain contract with the union or anything in order for safety precautions?
Yeah, so I won't be able to give you any specifics on that. That's something that I think John Fernandez and maybe Lillian Posadas in particular could speak more to. But I know that those requests have been made, and that there's efforts to get them online and oriented to the hospital systems. But of course, there are a lot of different steps that's involved with that as well, and some of them have been out of the inpatient practice for a while. But I understand that those wheels are moving.
Okay, thank you.
Oh, hey, Doc, this is Steve Limtiaco at PDN.
Hi, Steve.
Hi. So in April, late April, when the numbers were dropping, you had said that there likely would be a surge in the fall that would tax our healthcare system.
Yeah.
Is this the surge you anticipated? Is it happening for the reasons you thought it would be happening?
So it's happening, but not for the reasons that we had then, and that it was more of a project. It was of course the further out you project, the less reliable, but it was more in the sense of a very slow burn that just was going to make its way through, and that's where you're seeing this uptick. Now we thought that there still may be a spike, but that was more related to the addition of influenza, adding to the comorbidities for everybody and especially in a dual infection. And so dealing with flu season and then at the same time as COVID, that was, and we haven't necessarily seen that entirely yet. We are already starting because there are a number of influenza cases that are showing up now in the hospitals.
Thanks, Doc.
Hey, Doc, Nick again with the Post. You had mentioned that treatment for COVID is constantly evolving. And so my question is in regards to that treatment that you mentioned.
Remdesivir. Mm-hmm.
Right. And how much of that do we have available, and who decides, how is it determined who gets that?
Yeah, so primarily that's GMH. It handles the stockpile, so to speak. And right now, I believe we have. I think the last we heard was either 3 or 6 rounds. Sorry, there's 4. Yeah, so there's 4 rounds available right now for any new intensive care patients.
Okay, so that's been pretty helpful then in the ICU patients that we've been getting thus far.
Yeah, and so I think a lot of the success, overall, for some of the ICU patients who have made the turn and have been able to be discharged was a combination of a lot of course, different efforts. But the one medicine that we know that has good data is remdesivir and corticosteroids.
A separate note, Doc, I know in yesterday's press conference they had mentioned that Secretary Esper would be arriving on island today. I was wondering if you were going to be involved in those discussions, where and what will that be? What will that include?
I'm sorry, I'm just feeling because thank you for asking that so that we can make the clarification, and that there was a misunderstanding about that, and that in terms of that, no, we are not meeting with the Secretary of Defense, and that it was just a mistake in terms of the that we were meeting with FEMA and what's called ASPR, which is the Assistant Secretary of Preparedness and Readiness, right? And so it was the similar sounding names of ASPAR and ESPER, and so the governor had misspoke, but she clearly acknowledges that. But she is meeting with him tomorrow, so that's, I want to be clear about that. And so she does have a meeting Saturday morning with the Secretary of Defense.
Okay, and that's going to be. Do you have any information on that? Or will you be included in that discussion?
Oh no, and so we're not included in that, and I know that they have other things to discuss from obviously a DoD standpoint, but she is for sure going to discuss the request that we have made as well.
I just had a couple more questions in regards to GRMC, if I can. I know that early on, GRMC is supposed to be the divert hospital for COVID patients, but it also has what we've been noticing, a high rate of COVID infections. And so it kind of seems like, there's a blurred line. There's a blurred line in all that. So how is that being addressed?
So can I clarify? You said so. GRMC being the non-COVID hospital, you said divert. I wasn't sure what you meant.
Right, the non-COVID.
Yeah, so the reason why you're seeing COVID patients there is because they still show up to the emergency room sick and ill, and then they may have obvious signs and symptoms that is consistent with COVID-19, and so they're tested there, and then they end up being positive. And usually it's been especially over the past few months, it's been quite seamless in terms of being identified as positive and then moving toward GMH. But with everything backed up, it's been difficult to do that in a safe manner. And so right now, GRMC, which is these patients are still boarding in GRMC's emergency department, which is the safest place for them at this point, but it's still not the ideal in that we want to get them to GMH.
Okay.
Speaking of that, Doc, how has COVID impacted your hospital, GRMC's, and GMH's ability to handle non-COVID related cases?
It's if anything, that's probably just as dangerous as COVID itself. And so that a lot of these patients that don't have COVID are coming in much sicker for their other that who would have been hospitalized otherwise in a more controlled setting, probably in a lesser degree of morbidity that they had. So the key thing is that they're coming sicker and later, and so that makes it much more difficult for us to treat them and to turn them around in a way that we know that we could have otherwise. So in the earlier part of the pandemic, we were dealing with a sense at both GRMC and GMH that wasn't as stretched with non-COVID while we were having our first surge of COVID-19 patients. And so we actually saw more of the surge of the non-COVID patients after. And again, that's because of the delay. But this time around, when we had this surge that we currently are in, both hospitals were already full with non-COVID. And so that's a very, very different situation, and why it's been very difficult for us to give the care at the proper level that we are comfortable with, and that these patients deserve. The other thing is that it's to understand that the stress on the nursing, the beds really matter based on our nursing staff availability. And one thing that's, I think, underappreciated throughout the community is how much of a lot of the nurses work at both hospitals. They may work primarily at one and then moonlight at the other. And so when one goes out, the other hospital is typically affected as well.
Yeah, so that sounds like there's even greater urgency to bring in the cavalry, if you will, the reinforcements.
Yes.
And to Nestor's question, Doctor, my last question is about, even if you're not sure of the numbers in regards to how many patients might have got infected with the virus, I was wondering in terms of those patients that were either getting care at GMH or GRMC for non-COVID diseases, are we seeing these patients getting care and then turning up positive while being treated?
Yeah, I think what you're asking for is specifically what's called a nosocomial infection, or an infection that happens that a patient can get that gets while in the hospital and didn't necessarily come in with it. And so I think that part is still very much being investigated. I know there's suspicions, and we always look for it, even with the tiniest suspicion. And this is not just for COVID-19; it's for any part. That's why at any point being admitted to the hospital is never completely benign thing, and that minimizing length of stays in the hospital is important because in order to minimize this. But I don't have those numbers, but I know that it's a grave concern that we have, and I know it's being looked at very, very clearly, and so it remains to be seen what comes up from those investigations.
Hello again.
Yes, Joanna.
Do you have data on the level of emotional or psychological trauma attributed to the pandemic, and what is like public health or Guam behavioral health doing to ease all of these people's concerns?
Yeah, John, I think that's a very important question that you have, and unfortunately, I don't have any data on that, but I'm sure that it exists in some fashion, and that I know Guam behavioral health is taking the lead in a lot of this, and the reality is that even at the same time, most people get their behavioral health care from their actual primary care physicians. And so I know that that's being addressed as well, and that the medical community is very sensitive to that. It is a key comorbidity, is what I would say, and that we forget that the psychological part of our well-being is just as important as the physical. And so and it definitely is taking a toll, and even in especially just as much in the non-COVID patients.
Okay, thank you.
Thank you, everyone. If there are no more questions, I'd like to let Dr. Felix get back to his work. Thank you for joining us. And if you have any further questions, you know how to reach me. Thank you for joining us.
Thank you.